Good day, everyone. Special instructor, Mr. Baldaman. We are the Group 7, and today we will be presenting the Senate Bill number 1569, Series 2022, the Philippine e-health system. So this report was presented by Ms. Acobo, Mr. Concepcion, Lasaka, yours truly, and Leslie Nakalaban. So for our learning objectives, at the end of the reporting, the students will be able to define the Senate Bill number 1569, Series 2022, and its role in the Philippine healthcare system. Identify the benefits of the national e-health and other healthcares, and discuss potential challenges and considerations in implementing the Philippine e-health system. So for the introduction, Senate Bill number 1569, series of 2022, also called the Philippine e-health System Act, was filed by Senator Ramon Bong Revilla Jr. on November 29, 2022. The bill is still pending in committee, and it aims to build a nationwide e-health system that uses digital tools like electronic health records and telemedicine to make healthcare more accessible, efficient, and secure for all Filipinos.
So, what is Senate Bill number 1569? So, formally recognizing e-health as an equal to other healthcare delivery methods significantly impacts the nursing profession. So, this recognition means that telehealth and telemedicine are no longer considered secondary alternative approaches. They are now fully integrated into the healthcare system. So, for nurses, this shift requires adapting to new modes of patient care that rely on digital tools and virtual communication. It emphasizes the need for nurses to develop competences in using electronic health records, teleconsultation platforms, monitoring devices, and other digital health technologies. Next slide, please. So, in the context of telehealth and telemedicine, nurses are now expected to provide care, education, triage, and follow up virtually. So, this demands not only clinical skills but also digital literacy, strong communication abilities, and familiarity with data privacy regulations. So, furthermore, it allows nurses to reach patients in remote or underserved areas, thus improving healthcare accessibility and continuity of care. Overall, the bill empowers nurses to expand their rules, embrace innovation, and become key player and the digital transformation of healthcare. Next slide.
So good afternoon, everyone. I am Christina K. Nagalaban. So let me report about how the Senate Bill number 1569's Declaration of e-health as a policy framework and its goal of a coherent and coordinated system affect the current fragmented state of the health information technology in the country. Next, please. Policy framework. Integration system. The policy framework provides a national standard for interoperability by requiring systems to connect and share data. The bill promotes seamless transfer of patient information across the healthcare facilities and levels of care. Next is enhanced coordination. The bill strengthens the trust and by ensuring that patient is accessible for market health patients and tertiary hospitals. This reduces the need for repeated diagnostics and manual requests for efficiency and patient experience. Next, under governance, with e-health declared as national policies, the DOH and related agencies gain authority to enforce compliance, monitor data quality, and allocate resources. Next, last one is operational efficiency. The redundancy is diagnostic process speeds up field health claims processing and strengthening epidemiological reporting. It also improves the ability to respond to health emergencies by consolidating data sources.
So, as what you can see from the screen or the slide, which states that the bill mandates the establishment of the national e-health system and the health sector enterprise architecture. So, to answer the question that states that what are the implications of this for the role of the nurse informatics specialist, so we're going to tackle that by talking about the establishment of the national e-health system and health sector enterprise architecture. So, as we all know, the Senate Bill number 1569 mandates the national e-health system and the health sector enterprise architecture. of which have a goal to the standardized that technology, be interoperable, and lastly is to coordinate with the health IT system. So this elevates the role from the supportive role to the strategic leadership of health information management for the nurse information specialists. So they bridge between the clinical practice and the health information technology. For the key responsibilities, they must ensure that the data equality and interoperability. Next is they advocate for the user-centered system design. Next is they lead for capacity building and training. Next is they monitor compliance with e-health standards, and lastly is they support the evidence-based decision making. So therefore, with the establishment of the national e-health system in the health sector enterprise architecture, nurse informatics specialists will be at the forefront of the digital health transformation in the Philippines, ensuring that the technology serves both patients and healthcare providers effectively. So for the answer to the question, which is the implications, so the nurses becomes the change agents in the digital health. They also become strong influence in the health policy and the IT development. And lastly is they enhance the patient safety and the continuity of care.
So good afternoon, everyone. So once again, I am Raya Riza Amlasaka, and in my part of the discussion, I will explain the three main areas. First, the impact on nurses' daily practice. Second, I will share how this bill supports existing laws. And lastly, I will talk about the challenges and points to watch. So for the impact on nurses' daily practice, so first, this law gives us quicker access to updated DOH guidelines and protocols. With the e-health system, the healthcare workers like nurses can easily get reliable and timely information. So this means we can follow the latest standards in caring for patients. Second, it helps us more organize and consistent patient records and reports. So since the law supports ICT and medical infrastructure, patient data can be properly stored and shared. So this avoids confusion and makes documentation clearer for nurses. Next slide, please. So third, it provides improved tools like electronic medical records and telehealth. So these tools help us track patients better, especially those in far areas who may not always go to the hospital. So telehealth makes care more accessible, while EMRs make patient information easier to manage. And lastly, it increases our responsibility in handling patient data. The DOH will coordinate with other agencies to make sure data is secure. So, as nurses, we must strictly follow these protocols to protect the confidentiality of our patients. Oh, no. So, last pala is the need for additional training. Nurses and other healthcare professionals will need training to use new e health systems and technologies effectively. The Act also focuses on building skilled human resources to maintain these systems. Next slide, please. So, for the next slide, how the Philippine e-health systems and services act support existing laws. So first, this bill supports the objectives of the Universal Healthcare Act by aiming to improve access to quality healthcare services through the use of information and communication technologies. The bill's focus in establishing a national e-health system complements the goals of RA 1123. So second, it complies with the Data Privacy Act or RA 10173. Since the law recognizes the importance of securing personal information, it ensures that policies and mechanisms are in place to protect patient data. So this is very important for us nurses or future nurses because we are directly handling sensitive patient records. Next slide, please. So the challenges and points to watch is first is the issue of centralization versus privacy risk. Having one centralized e-health system is useful, but it can also expose patient privacy if not managed properly. Second, there is the need to obtain proper patient consent. With the electronic health records and telehealth, we must always make sure patients understand and agree before their data is collected and used. So third, next slide please. So third, there is uneven access to technology. Some areas in the Philippines still have limited internet or ICT facilities. While the law aims to improve this, it will take time and resources to achieve equal access for everyone. And lastly, oh my, the need for early training. The bill emphasizes the importance of establishing and supporting ICT and medical infrastructure to enable the provision of e-health services and health information exchange. So this infrastructure aims to improve the organization and consistency of patient records and reports. Next, so lastly, there must be a clear accountability in rules on data handling. The law requires policies that define the responsibilities of healthcare workers and institutions. For nurses, this means we must follow clear guidelines in protecting rather patient information. So next slide, please. So in conclusion, Senate Bill number 1569 aims to build a coordinated national e-health system to fix the fragmented health information technology in the Philippines. It creates a health sector enterprise architecture, giving nurse informatics specialists a bigger role in handling and understanding health data. So by treating e-health like other healthcare methods, the bill supports telehealth and telemedicine, making care more accessible. Strengthening the DOH IT service ensures nurses can access to up-to-date information. So the law also follows the Data Privacy Act and Universal Health Care Act to protect patient information. So these are our references. Thank you.